Can you shed some light on the whole episode?
Actually, when we received sample yesterday, our team, core team, they started working on it, and they found that this particular sample which was forwarded to us was negative for COVID-19. Mr. Dr. Workakoti, he will explain you in detail about that.
So actually for the viewers it is a good news today that till now in Assam and in whole of Northeast no case of COVID-19 has been detected. So the case that has been referred from Jorhat Medical College, so we received at around 11:30 in the evening. So we did, actually that was a screening test. So screening test has to be reconfirmed. So screening test has to be reconfirmed with confirmatory test. So Regional Medical Research Center out here, we are doing the confirmation test. So initially it will have, there are a lot of coronavirus circulating in human. 4 common coronavirus are there, actually OC43, NL63. They may also get detected by this screening test actually. So generally that is why we have confirmatory tests. So once we detect coronavirus, we have to confirm it. So we confirm that it is not COVID-19. It was not the novel coronavirus. So generally that is why confirmatory tests are there. So the case was negative, and it is good that it is not the novel coronavirus. And till now we are free from coronavirus in Assam. And your media has to play a big role actually, because to allay the fear of the people. So it's like a fear psychosis in the society is going on. So Prime Minister today has given Janta curfew. It's a very good awareness, so people should know social distancing, and we can fight the virus, because we are in Assam everywhere. But we cannot overload the health system. If there is an explosive outbreak, the health system will be overloaded and nobody will be treated properly. So if we can, and every citizen in Assam or Northeast or India has a role to play. They has to know the hand hygiene, the respiratory hygiene, cough etiquette, and social distancing. So if we do that, we can be better off than many countries. Like Italy is facing a big problem. Yesterday they have around, within 24 hours they had 793 deaths in Italy. So our situation is very good in India. So we hope so with this awareness program also. And also at 5 p.m. I think so we should boost the health workers, medical practitioners, that to give them boost, because they are also human. They will be treating patients of COVID-19. So we should boost all the health workers, everyone working on day and night, even the IDSP. IDSP in Dibrugarh has done a very excellent job. They have, from January, they have been out there actually in Dibrugarh screening people from airport everywhere. That is why all over India we have less number of cases actually. And even ICMR last week has ordered more than 1 million test reagents. WHO will be giving another 1 million. So we'll have a lot of stock of so that we can test everyone who is having fever and cough within the next few days. So next 10 days, 15 days is very critical, and the media out here has to play a big role actually. So they should not create a fear psychosis among the people, and they should give the good news that you can prevent or you can stop this virus, because this virus it is inevitable that it will come out here in Dibrugarh, and we'll have a lot of cases. But 5% of the cases will have mild fever and cough, no treatment will be required. 5% will have pneumonia. Maybe out of that, 10% may require ventilation out of the 5%. So we have to be sure that administration, that ventilation and ventilators out here in Dibrugarh is adequate, and all over Assam is adequate. Even we had a discussion with the health minister yesterday. He had given some 50 orders for, most probably, I don't know exactly, it is on the way. So lot of actually there is scarcity actually. Ventilators are out of stock, so we have to be careful. We have to give a triage. Triage means those who require treatment. those who require, they are breathlessness, they require treatment, ventilation, we should give them bed. Not any person who has just come with fever and cough, mild infection, they could be isolated at home only, home quarantine. So the media should focus this, and they should allay the fear of the society that it is, nobody should fear. If you practice hand hygiene, if you practice respiratory and cough etiquette, then we can defeat this virus. That is all I wanted to say.